Learn about the CAMP test for Streptococcus agalactiae in this informative video. We'll cover what the CAMP test is, how it's performed, and the history behind this important diagnostic tool. General information. Streptococcus agalactiae is a bacterium that is CAMP test positive. This test is used to identify the presence of the bacterium, which is known to cause infections in humans. The CAMP test is conducted by streaking a beta hemolysis producing Staphylococcus aureus strain and Streptococcus agalactiae parallel to each other on a blood agar plate. Suspect cultures are then streaked at right angles in between, but not touching, the two initial streaks. If Streptococcus agalactiae is present, hemolysis will be enhanced in the vicinity of S. aureus, creating a distinctive arrowhead shape. The CAMP factor reaction was first described in 1944 by Christie, Atkins, and Munch-Peterson. It refers to the synergistic lysis of erythrocytes by the beta-hemolysin of Staphylococcus aureus and the extracellular CFP protein of Streptococcus agalactiae. This synergistic action is what causes the enhanced hemolysis seen in the CAMP test. Poem, Arrowhead of Hemolysis. On blood agar's crimson field, two streaks, a story to be revealed. Staph aureus, a golden line, beside agalactiae, in design. A cross streak, a meeting place, where hemolysis shows its grace. An arrowhead, sharp and clear, a positive CAMP test, drawing near.